In the next several minutes, you will learn about the care and cleaning of the TENEO and SINIUS treatment centers, using a TENEO unit as an example. Remove the disinfection and sterilization instruments. Follow the instructions in the user manual for each instrument. Clean the upholstery of the treatment center and seat by wiping with disinfectant. Be sure to wipe the upholstery dry to remove excess cleaning fluid. Clean the holders on the dentist element side and the instrument hoses. Clean the instruments used in the last treatment using the purge function. Make sure that the flow channel of the instruments is always fully open. This function flushes the instruments simultaneously for a set period of time. Activate this function in the submenu of the Start dialog on the Easy Touch user interface. Hold the instruments over the cuspidor and press Start. Next, clean the hoses and surfaces on the assistant side. Clean the suction hoses by placing the hoses on the adapters and start the cleaning process on the water unit by pressing the green button. Finally, clean the gold trap and cuspidor. Clean the suction hose filters daily. If the unit does not include the option of a chemical cleaning of the suction hoses, they must be cleaned separately. Attach the suction hose adapter to the cuspidor and connect the suction hoses. Add 1 liter of cleaning fluid. After treating the last patient at the end of the day, start the Auto Purge function in the submenu of the Start dialog to flush the instruments. This function flushes all water channels and suction hoses simultaneously for the preset period and cleans the suction hoses. Make sure that the water channel of the instrument hoses is fully open. Then, attach the instruments of the dentist and assistant elements and the suction hoses to the adapters in the water unit. All elements of the treatment center that must meet specific hygienic requirements are removable as needed and can be thermally disinfected or sterilized. These elements include the tray, the silicone pads, the instrument holders, the handles, and the cuspidor. Switch the unit off after the daily cleaning. Do not remove the instruments from the cleaning adapters. When the unit is restarted the next day, the Auto Purge program begins automatically. Now you have time to reattach the cleaned elements to the unit before the instrument flushing process is complete. Clean the upholstery of the treatment center and seat using a cleaning solution. Be sure to wipe the upholstery dry to remove excess cleaning fluid. Change the cotton wool roll on the turbine hose if you work with a turbine. Separate the suction handpieces and grease the O-rings after thermal disinfection or sterilization, as well as once a week. If the unit includes the option of chemical suction hose cleaning, the drainage channels of the cuspidor must be cleaned once a week. Fill the cuspidor with 1 liter of cleaning fluid. If the chemical option for cleaning the suction hoses is not included, follow the instructions for the daily cleaning without this option. Attach the suction hose adapter to the cuspidor and connect the suction hoses. Add 1 liter of cleaning fluid. If you have the option of chemical suction hose cleaning, fill the water unit tank with cleaning solution when Chem appears in the taskbar on the display. If an integrated amalgam separator is installed, you have to change the rotor. A symbol appears on the Easy Touch user interface when it is time to change it. Start the sanitization function in the submenu of the Start dialog to sanitize the water channels. This function intensively disinfects all water channels as well as the instrument hoses and reduces the biofilm over several hours. Make sure that the water channel of the instrument hoses is fully open. Then attach the instruments of the dentist and assistant elements and the suction hoses to the adapters in the water unit. Now start the function. You can follow the progress of the individual steps on the Easy Touch. When it reaches step 4, the unit automatically switches off and the chemicals in the water channels are allowed to take effect. When the unit is switched on again, all water channels and instrument hoses are flushed with water, and then a solution of water and Dentocept P is poured into the water channels and instrument hoses again. Sanitization is completed with step 6, and the instruments and suction hoses can be returned to the dentist and assistant elements.